Okay, so this is the first video of chapter 23, the elbow, and as always, we're going to start with the anatomy. So this video will talk about osteology, ligaments, muscles, and arteries and nerves in the cubital fossa and the cubital tunnel. So if you haven't watched the shoulder lectures, especially the brachial plexus video, then please do so before you watch this video. Okay, so let's begin.
All right, first let's take a look at the joints that constitute of your elbow. So there are three separate joints in the elbow. The first one is the articulation between the humerus and the ulnar, which is also known as humeral ulnar joint. And this particular joint is the primary skeletal constitution of the elbow. So that, if you look in the back, actually, the humerus and ulnar articulate uh, nicely to each other compared to the radius is just kind of sitting there. Okay, so even though the humeral radial joint, which is the second joint that is between the humerus and the radius, is also part of the elbow joint, the primary bony stability is coming from the humerus and the radius. And later we're gonna see the wrist. I mean, not this week, but you appreciate how radius was small in the elbow, but once it gets to the wrist, it gets broader and it provides a majority of the stability in this wrist joint. And then the ulna becomes much skinnier, and then there's a gap between the ulna and the carpal bones that we're going to review later. But anyway, so those are the two joints that would create a movement of flexion and extension at the elbow. And these joints are the hinge joint, which indicates that those are the only movement which occurs to the elbow. Okay. Well, elbow joint. Okay. And the third joint that we're going to talk about is the proximal radial ulnar joint, which is the joint between the radius and the ulnar. Okay. And the proximal is important because one more radial ulnar joint is going to be located distally at the wrist. So make sure you put proximal to differentiate between two. Okay, so that is the third joint in your elbow, and then the movement which occurs in this joint is the supination and pronation. And you notice when you are in anatomical position, these two bones, the radius and the ulnar, are parallel to each other. However, if you pronate, so the pronation of the forearm is when you bring your hands or palms down so that the palm is facing downward. Okay, so that is when these two bones cross each other, as you can see in a little video in a corner up here. Okay, so that is the pronation. And then when you supinate completely, then again, once again, these two bones are parallel to each other. Okay, so these are the three different joints that constitute the elbow. Once again, flexion and extension happens with the humeral radial and the humeral ulnar joints, and then the pronation and supination occurs at the proximal radial ulnar joint. Okay, so next we're going to dive into the bony structure and some important landmark for each bony structure. So let's start with the humerus. And humerus is kind of similar to the femur as we saw in the knee. And we have two bump at the distal part of the humerus, which are also known as condyle. And then again, epicondyle is above the condyle. So it's this particular region right here is the epicondyle. And of course, we have one in a medial and a one on a lateral. So medial epicondyle and a lateral epicondyle. Again, these are two important structure where a lot of the forearm musculature originate from. So make sure you remember these. Okay. And then anteriorly, we have two fossa and then two articular surfaces. Okay, so let's take a look at that. First, I want to zoom in just a bit. Okay, so you can see there's this one fossa, okay, and then second fossa. And you can tell already that once, well, this is extended position, but once you start to flex, these articular surface of the radius and ulna will come down or come up, I should say, and sit in this fossa. Okay, so this fossa is named as the radial fossa. That's easy, right? Because the radial head will come and sits in it. And this one is called the coronoid fossa. And then this particular little, the part that's sticking out, this is called the coronoid process of ulna. And so that's why this is called a coronoid fossa. Again, these two matches as you fully flexes your elbow. Okay. And in addition to that, there are names for two articular surface. So right here, very distal end of the humerus, where the radial head is articulating with, this is called the capitulum. Okay, so capitulum is where the radial head articulate with. And then we also have this nice trochlea. Okay, here's capitulum. Okay. And once again, as I mentioned before, the elbow flexion and extension, the primary hinge joint is coming from the humerus and the ulnar articulation. So because we have this trochlea that are, articulating with the trochlea notch of the ulna, which we're going to see in a minute, it creates this nice smooth movement of flexion and extension. Okay. So that is it for, humerus. I want to quickly see the back, the posterior aspect of it. Okay, so I'm going to slowly turn. Okay, so here, I'm going to hide the ulnar. We have another fossa. This is important. This is also known as olecranon fossa because where the olecranon of the ulna will come and articulate with. Okay, so this is olecranon fossa. And then in fact, if you, palpate the back of your elbow, you flex your elbow and then you kind of follow this bump up, then you can feel this little depression on your own. Okay, so that is the olecranon fossa, but obviously you have the olecranon that is occupying the space. Okay, so if I replace the olecranon or the ulna, then ulna is sitting in the olecranon fossa. Okay, so here, since we are in the posterior view, we're going to move on to some structures of the ulna. So first, most distinct bump here, as you see in the bump of your elbow, this is olecranon. Okay. And we already talked about how the articulation between the humerus and the ulnar, so I'm not going to repeat myself. Okay, so go back to anterior aspect. And then maybe hide the humerus as well. Okay, so here's the ulna. Okay, so the shape is very unique, right? It has this hook. The hook, the back portion is what we saw in the olecranon earlier. Okay, so the last structure that I want to mention is the ulnar tuberosity. Ulnar tuberosity is right here. There's a little ridge. So this part, and this is where the brachialis muscle inserts to. So that is significant. Okay, so let's take a look at the radius. And radius has this nice head on the top, and which we saw where the it articulate with the humerus. And underneath we have this skinnier part. This is called the neck of the radius. Okay, and underneath the neck, we have a little bump right here. This is called a radial tuberosity. Okay, this is important structure because this is where the biceps brachii inserts to. And oftentimes people confuse that biceps inserts to ulna, but in fact it inserts to radius. Okay, so that is the basic bony structure, and I'm gonna move on to ligamentous tissue to explore here. So here's the medial aspect of the elbow, and this particular ligaments which has three different bands, is called the ulnar collateral ligament. Much like the medial collateral ligaments on the knee, it's located on the medial side and it protects against the valgus force applied to the elbow. Okay, so there are three different parts, and the first part, right here, let me draw it for you. This part right here, this is called the anterior band. Okay, so anterior band is the strongest, and much weaker is the posterior and the transverse band. Okay, so the anterior and a posterior band, this is the anterior and this is the posterior, connects the humerus and the ulnar, obviously. But you have another one, this is called the transverse band. Okay, so it actually runs from one part of the ulnar to the other. Okay, so it kind of runs from the posterior where the olecranon is located and into the choroid process. Okay, so it is kind of unique because normally ligament will connect two different bones, but in this case, it connects the ulna, one part of the ulna to the other part of the ulna. Okay, so once again, so this triangle shape ligament is the ulnar collateral ligament, which prevents from the valgus force. On the lateral side, you have something similar. So we have this nice triangle shape, but if I break it down, it's actually three different structures. So the first one, it connects the humerus to ulna. Okay, so this is called lateral ulnar collateral ligament. Okay, so it's confusing, right? Because when you say ulnar collateral ligament, then automatically think that it's located on the medial side. But in this case, because ulna is kind of sitting more on the back of your elbow, so you could actually have ligament that connects the humerus and the ulna, but located on the lateral side. Okay, but this is the part of radial-collateral ligament complex. Okay, so but once again, this is called the lateral ulnar collateral ligament right here. It's actually connected underneath this next ligament that I want to talk about. Okay, so this one, this particular ligament that shapes like a ring actually, wraps around the radial head, and this is called the annular ligament. Okay, so it's a circular ligament, and this is where the radial head is sitting inside of the ring, and then it rotates, and when you do pronation and a supination. Okay, so that is the annular ligament. And then this little guy right here, this is called the connection between the humerus and the radius. So this is called the lateral or the radial collateral ligament. Okay, so these three structure provides stability against varus force. Okay, so that was the ligament, and now we're gonna move on to talk about musculature. So I'm gonna divide it into different movement, and first let's talk about flexion. So the elbow flexion is done by three different musculature, and the first one is the biceps brachii. So the biceps brachii originate from the shoulder, and we already saw that short head originate from coracoid process of the scapula, and the long head originate from the top of the labrum, the superior labrum, and they come down and inserts to the radial tuberosity. Okay, so let's see if I can isolate the biceps here. There we go. Okay, so you might be surprised, or you have this stereotype image of biceps brachii is a strong musculature in your arm, because sometimes you call it as like a gun, or like you flexes your biceps, then you have this nice mountain looking shape on your upper arm. But surprisingly, this is not the prime mover for elbow flexion. The prime mover for the elbow flexion is brachialis, which we're going to see next. So let's go back. Oh, and then the primary function of this biceps brachii is the supination. Okay, so when your forearm is slightly pronated, you know, because right now it is supinated already, but if you pronate, then the radial tuberosity will kind of come further medially, and when you flexes or when you contract the biceps brachii, then it'll supinate your forearm. Okay, so it's a strong supinator. So let's take a look at the brachialis. Here we go. Okay, so here's the brachialis muscle. And in reality, like if you do cadaver dissection, then biceps brachii is much thin and skinnier. And then the brachialis muscle is actually wide and thick muscle. So this particular muscle originates from the anterior aspect of the humerus and then inserts to chronoid process and ulnar tuberosity, as we talked about before. So let's take a look, just like that. So because this muscle is a short single joint muscle, it only crosses the elbow joint. All they do is flexion of the elbow. Okay, so again, this is the primary workhorse when you do elbow flexion. Okay, so the third elbow flexor is going to be the brachioradialis, which is this muscle right here. So let me isolate here. So the brachioradialis originate from the lower part of the humerus, the lateral humerus, and then inserts at the styloid process of the radius, which is at the wrist. And this particular muscle is the strongest flexor when the forearm is in a neutral position, much like when you're grabbing, a coffee mug or some sort of handle. When you are completely supinated, which is the basically anatomical position, right? And then when you turn the palm down, which is the pronated position. So halfway in between is like the neutral position. And again, every time when you shake hands or grab some coffee, drinking coffee, and that you're in the neutral position. And this particular muscle is most strongest or active in this particular position, and that's how we test the brachioradialis. Okay, so that was the three primary elbow flexors, and now we want to move on to the extensors. And there are only two elbow extensors, and the first one is triceps brachii. So the triceps brachii, as the name indicate, has three head, and so we have long head and lateral head, which is located more superficially, and then the medial head. So let's take a look, isolate this muscle. Ooh. Okay, so here we go. And what we are seeing right now is, the yellow highlighted area is the long head of the triceps. The long head originates from the scapula, the infraglenoid tubercle of the scapula. And then the right side is the lateral head, okay? And then underneath that, we also have a medial head, but the lateral head and the medial head both originate from the shaft of humerus. And then all three heads inserts to the olecranon of the ulna, okay? And then this is the strong extensor, and it usually, this is the pretty much the only strong extensor, because the second muscle that we're going to see is anconeus, which is tiny muscle that are located close to the elbow joint. Okay, so with that said, let's move on to the anconeus. So anconeus is this small triangle shaped muscle, and it originates from the posterior aspect of the lateral epicondyle of the humerus, and then inserts to the ulna shaft, much kind of closer to the olecranon, okay? And then what they do is it assists the triceps brachii to extend the elbow, okay? But once again, you can really see the difference between the triceps brachii and the anconeus, how the size is different. So triceps brachii will do most of the work, and then anconeus will probably have a lot of to do with the proprioception, which is the sensor, right, to detect the muscular length and then the information surrounding the joint. Now we want to move on to the pronation and the supination movement and which musculature will do that particular movement. And the first one is the pronation. So the pronation is done by the pronator teres and the pronator quadratus. So first, let's take a look at the pronator teres. So the pronator teres is one of the muscle that originate from the medial epicondyle and inserts to the middle 1/3 of anterolateral aspect of the radius, meaning that mid radius, but it's located on the anteriorly. So what they do is when they contract, it of course pronates, right? So pronation, palm down. The other muscle that are located in a deep aspect is the pronator quadratus. There we go. So here's the pronator quadratus muscle, and it's kind of like a wristband, right? It connects the radius and the ulna together. And by contracting this musculature, the radius will move on top of the ulna, creating the pronation movement. And let's move on to the supination. And earlier, when I talk about biceps brachii, I already said that biceps brachii is a strong supinator. And along with that, we have one more supinator that are located on right here. I have to strip down some muscle to show you. Here we go. So the supinator muscle, let's isolate. Okay, it kind of wraps around the radius. So it originates both from humerus and the ulnar, and kind of wraps around the radius and then inserts to anterior medial aspect of the radius. Okay, and once this muscle contracts, obviously it'll supinate. The once the pronated position would be when the radius is crossed over the ulna, but once this muscle contracts, it'll come back to supination. Okay, so that's it for the musculature of the elbow. Not too bad. And I know there are a bunch of other musculature that are located on a forearm, but those are the muscle that has majority of the function is at the wrist. So I'm not going to go into too much detail right now. So make sure you know whatever the muscle that I introduced to you today. So now we have reviewed the osteology and ligamentous structure and also the musculature. Last thing I want to talk about is the arterial structure and the nerve, and along with some space that is clinically important. So the first I want to talk about cubital fossa. So cubital fossa is a triangle-shaped structure that are located on the anterior aspect of the elbow. So cubital fossa is like a reverse triangle shape. So first connect the medial epicondyle and the lateral epicondyle, and then you have the muscular border that are, the brachioradialis on the lateral side, and then pronator teres on the medial side. So this particular triangle is in front of your elbow, and it's important area because a lot of the nerve and then the arterial structures are running through it. Okay, but as you can see right now, that biceps brachii muscle is covering the particular space. So biceps brachii in this case is considered as a roof of the cubital fossa. So I'm going to go ahead and remove biceps brachii here. Okay, so we have a much better view of the inside of the cubital fossa. And as you can see, there are several nerves that are running in front and the back of the elbow, and then the arterial supply as well. Okay, so let's take a look at the arterial supply first. So as you can see, this big artery that are coming down is the brachial artery. Okay, So the brachial artery comes down and it runs in front of the elbow. And then later, after passing through the cubital fossa, it'll divide into the ulnar and the radial artery. So the radial is this side, and then it's really hard to click, but that is the pink highlighted artery right now is the ulnar artery. Okay, so that is happening here in front of the cubital fossa. And the next, I want to talk about the nerve, because there are several nerves that are running through. Okay, so the first one on the lateral side, we can see that radial nerve is coming down. Okay, remember the radial nerve is coming from the posterior, division of the brachial plexus, and it comes down and then be divided into the radial nerve and the axillary nerve, right? And the radial nerve runs posterior aspect of the humerus and comes down. But once it gets to the cubital fossa area or the elbow area, you can see that radial nerve is actually coming anteriorly and it runs in front of the elbow. Okay, rather than back of the elbow, it comes in front of the elbow, and then once it hits the elbow, it'll come down and innervates all the forearm extensors. Okay, so the back posterior compartment of the forearm musculature, which we'll go over next week. Okay, so the radial nerve comes down, but runs in front of the elbow. Okay, and we also have, you might wonder what this is. This is the musculocutaneous nerve, if I can highlight it right here. Okay, so musculocutaneous nerve, if you remember from brachial plexus, it pokes through the coracobrachialis and innervates the biceps brachii, brachialis, right? And then comes down and it becomes cutaneous, so inserts to the skin. So that's why it kind of disappears, and it's not the nerve it's cut off here, it's because it becomes cutaneous, so that's why it kind of disappears. Okay, so the next nerve right here is the median nerve. So median nerve is the center of the M when you draw brachial plexus. It comes down, it doesn't do anything for the upper arm, but then it runs relatively medial side of the cubital fossa and innervates all the musculature of the forearm flexors. Okay, so the pronator teres is one of them, and there are 3 other musculature that are located superficially on the medial side of the forearm. Once again, we're going to go over that in the next chapter. Okay, but what's important is that it's running in front of the elbow. Okay, and lastly is the ulnar nerve. Okay, so ulnar nerve is the only nerve that runs on the back side of the elbow. Okay, you notice that it comes from anterior side first. It's running relatively on the medial aspect of the of the upper arm, but then once it gets to the elbow, it'll wrap around the medial epicondyle and it runs behind it. Okay, and you can see nicely from here. Okay, you might notice by now that most of the major artery and nerves run in the flexed side of the joint, meaning that, in case of the elbow, when you flex it, then the anterior side will be scrunched together, and then the posterior side, the back side of the elbow, will get stretched out, right? In case of the knee, when you bend your knees, then anterior side is going to get stretched out, and then the posterior side will be crunched, right? Major arteries and nerve usually runs on the flexed or crunched side. Okay, so if the elbow's case, it's anterior. For the knee's case, it's posterior. And you can notice that for lower extremity, the sciatic nerve, the big nerve that are coming back, and then also even the femoral nerve and artery, which originate from the anteriorly, it'll runs to the back and then runs to the back of the knee, not the in front of the knee, because that's the extended side or stretched out side. Make sense? So the ulnar nerve is one of the few exceptions to the rule, which runs on the stretched out side of the joint. Because of the reason, it would provide it might not be a good word, but it would cause you a lot of the issues. Okay, so one of the issue would be injury to the ulnar collateral ligament, and this particular nerve is going to get irritated, okay, because of the valgus force that are, either repetitive or acute one-time valgus force is applied to the elbow, which causes the not only the ulnar collateral ligament but also the ulnar nerve will be damaged as well. So one of the procedures that they do is to move the ulnar nerve anteriorly, kind of by the medial nerve, so that it wouldn't cause you much issue later on. Okay. But anyway, this particular area is also known as cubital tunnel. Don't get confused. There's a cubital fossa, which is on the anterior aspect of the elbow, and then the cubital tunnel, which is the medial aspect of the elbow, where ulnar nerve is enclosed within that specific tunnel. And we'll talk more about that in the injury section. So anyway, but that is what I wanted to show you in the anatomy of the elbow, and that pretty much conclude everything.